Hello, this is the vertebrae, the spine. Okay, so this is our atlas. Remember, T before X, atlas, axis. Okay, X marks the spot. For axis, that's your dens. Remember, you like to do it in the den. So dens. And then we have how many cervical? There are 7. Because you get up at 7 in the morning. There are 5 thoracic and, there's 12 thoracic and there's 5 lumbar. The lumberjack, the heavy parts down at the bottom. Okay, so we also have the transverse foramen just in the cervical area where you can put, there's a little hole on the side here. Can you see that? So, transverse foramen. All right, you have your vertebral foramen in the middle, then all the spine, all the vertebrae. And then you also have your spinatus process, your transverse process, your body. What else do we have? We have your pedicle. That's a little circle pedal around the block. And then your lamina right here.
Show me the giraffe.
The giraffe. Yes. See the giraffe? That means you're going to have your sappy ears. Your superior, what is it? Superior what? Articular fossa right here, okay? And that's on these vertebrae. And I think that's it, right? Or your sacrum? Okay, sacrum. This is your median sacral crest. And then you have your sacral foramen. Okay, this is your ribs. You're going to have your manubrium, that little thick spot right there, in your body of the sternum. And then you're going to have your xiphoid process down here. If you give too many compressions, that'll break off in CPR. Just kidding. All right, so this is your first 7 are your true ribs. 7, lucky number. And then the 8 through 12 are your false ribs. And then you have costal cartilage. All right. And these are your 2 floating ribs in the back here. 11 and 12 float. All right, your maxilla. It consists of your infraorbital foramen. Then you have your palatine bone in here. This is your palatine process. This is your medial, that line is your medial palatine suture. Then you have your incisive fossa in there. And then you have your alveolar process out here, right next to that tooth, underneath that infraorbital foramen is the alveolar process. So this is your palatine bone, like we were saying. This is your maxilla. This is your zygomatic bone. You have your nasal bone. You have your lacrimal bone. Don't cry too much. Your vomer bone. And then we have our mandible sutures. You've got your coronal across the front. You've got your sagittal down the middle. You've got your squamous. And then your lambdoid is down here. This is your mandible. Mandible's awesome. Helps you talk. All right, so if you want to be an RN, you got to work your way up to the top. RN. Remember that. This is your ramus of your mandible. This is your mandibular notch. Okay, this is your mandibular condyle. And then you have your, what is this one? Your coronoid process. You get annoyed with people when they talk too much? Coronoid process. Okay, then you have your alveolar process here, and this right here, mental foramen, that hole, that's mental. Mental means chin. Okay, so you got your mandibular notch, your mental foramen, your ramus of the mandible, your mandibular condyle, and your mandibular angle down here at the bottom, and your coronoid process, and your alveolar process. Way to go. Temporal bone. Okay, so this is your zygomatic process. This is your, let me get in here, your jugular foramen. You want to look from this side. And you also have your carotid canal, which comes up through here. You have your styloid process, this little thing right here. You have your mandibular fossa right here, this little indention, and your external auditory medius right here, and your